My name is Dr. Obadiah Moyo, and I'm the Minister of Health and Child Care for the Republic of Zimbabwe.
And what are your impressions of the World Health Assembly so far?
My impression about the World Health Assembly, this is my first attendance as a Minister of Health. And I think it's a very, very good forum for enabling leaders from all countries in health to be able to meet and discuss and map the way forward, in making the world a better place to live in, making the world a better place for the general population, making sure that the whole world is healthy. It's not just from one country, but several countries. The collective approach, I think is a very useful approach, so that we are all able to share our problems and find solutions, from each other. Setting up teams, coming up with specific programs in which we can work on. So you can't do it alone. It's best done in a unified manner, so that you'll come up with solid solutions. The term, the world is a global village, is a reality. It was realized that, if you try and do things on your own, you will not be successful. Let me give you an example. Malaria control. Mosquitoes do not require passports to move from one country to the next. But if the 2 countries or 3 countries come together, they can work together to eliminate the problem of malaria as a result of, getting rid of the mosquitoes or controlling the mosquitoes. So that's just one example. Right now we're talking about NCDs, right? A global approach to NCDs is necessary, as yet in the past we were just talking about communicable diseases. Now we're talking about the non-communicable diseases. So it's an educational forum as well as a forum for exchange of views. We want a World Health Assembly which allows for the various specialists, the various specialization areas of medicine to be engaged and to talk as one voice. Like for instance, we've got the surgeons, the obstetric and gynecologists, the anesthetists. They're coming up with a program which is very, very useful. So that will be chained worldwide. It's a worldwide management of health. So it is necessary to be able to manage and administer the whole world from one source. That is the World Health Assembly.
And what is Zimbabwe doing to achieve primary health coverage as well as universal health coverage?
Zimbabwe is moving along with the rest of the world in ensuring that primary health care and universal health coverage is achieved. We have made sure that the local levels, at the district level, at the village level, we have healthcare facilities in the form of village health posts, which are well manned, by qualified personnel, village health care workers who are educated appropriately, rather than just a village health care worker whom you just wake up and give a task without training, coupled with the services of primary care nurses or even registered general nurses. That's how effective we want our service to be well manned by qualified personnel. We want an old lady to wake up the next morning if she's got a headache or whatever ailment, to be able to walk within close distance to a clinic, to a village health post, and seek for medical assistance and get it, right? If they have to test for a blood sugar, they should be able to do so. test for malaria, they should be able to do so. And also the medication must be available at that level so that they can be able to treat. It's not just a diagnostic, but also a curative center. And if the personnel at that level are not able to look after that patient, they can refer to the next level, which is the rural health care center, which is a much more integrated center, which is being looked after by a clinical officer who's got the same knowledge as the doctor and will be able to manage that patient, appropriately. And at that level, we also now start getting a birthing unit, right? At the village health post, they would have been tested if they were pregnant. If they are found pregnant, they will go for their antenatal care at the next level. So an integrated approach with a laboratory, with an imaging department, linked with telemedicine, teleradiology, and making sure that everything is available, and also pharmaceutical service at that level. And this is where you will find the referral going upwards to the district level. At the district level, we are looking at having specialists, in family medicine, looking after those facilities. These specialists are well versed, in various disciplines of medicine, and they can be able to look after the patients well. And our nursing staff is also available at all these levels. Lab scientists are available at all these levels, rehabilitation, and so forth and so forth. At the district level, they are all available. And then we have the doctor going around the district hospitals with a weekly round at the rural healthcare centers and also at the village health posts. So he does the rounds, but he might be based at the district hospital. And they will also equally refer the patients that they cannot manage to the provincial hospital, where we have more specialists in all the areas, and then they can also refer to the tertiary level, where we have the professors, the specialist consultants, they can handle much more complex cases at that level. And what we are emphasizing is that we do not want to see our clients, accessing service at the tertiary level. In the towns, we want them to access service through the clinics or their GPs. In the rural areas, through the village health post, and progress upwards until they are at the level where they have been looked after properly. Then the next issue is that of universal health coverage, right? We want to make sure that our patients, our population, is appropriately looked after in terms of their payment for the services. We are coming up with a national health insurance. The national health insurance, will be able to cover for every Zimbabwean's health bill, right? Modalities are already in place to make sure that the national health insurance is in place. We are working together with the Minister of Finance, Minister of Labor and Social Services to make sure that we come up with this body, which will be able to accumulate all the funds, bring in all the funds, harness all the funds, and be able to pay for the services. The regular medical aid societies will still remain there for those who want to access a more expensive service. So we are ensuring that the whole nation is covered through the national health insurance. An accessible service, an affordable service, and a service that is available. The 3 A's of healthcare, those are very, very vital for us. So our primary healthcare program is progressing well. We look at least 10 village health posts feeding into the rural healthcare center, and the districts also feeding into the provincial, and so on and so forth.
So why is global cooperation important to bring health and well-being to all?
Didn't hear that one.
Why is global cooperation important? Why is working together important to achieve health and well-being for all?
Yes, global cooperation, like I said earlier, without that cooperation, we will not be able to achieve the objectives. Global cooperation allows for resources to be pooled together and channeled to the various countries so that we can be able to benefit. Global cooperation allows for the first world to be able to look after the first world through contribution to the World Health Organization. Global cooperation through the various other partners, DFID, UNICEF, United Nations organizations, MSF, that type of thing, all working together, getting resources and making sure that the resources are appropriately utilized and well accounted for. That is the key.